On today's podcast, I have the pleasure of speaking with Dr. Christine Dunkley. Christine is a consultant psychotherapist, author, and international speaker on dialectical behaviour therapy, mindfulness and emotional pain. She is also a consultant trainer with the British Isles for DBT. She is also the clinical director of the mental health and training company Grayrock in the UK. She has worked with suicidal and self-harming clients for many years, which led her on to further qualify in DBT and on to become a DBT trainer and researcher. She gained her doctorate in the University of Southampton School of Health Sciences on the communication of emotional pain in suicidal clients. She is now the vice president for the Society for DBT. She has lectured to mental health professionals all over the world. Her company, Grayrock, is a training company providing CPD for mental health professionals. She has over 30 publications in the area of mental health. Her most recent book, Regulating Emotion the DBT Way, is out now. We talk about that on the podcast. We talk about emotional dysregulation, opposite action. So really hope you enjoy it. Please like and share where you can. Thank you very much. Hi, Christine. You're very welcome. Lovely to have you on.
Thank you for having me on.
Yeah, it's fantastic. Really excited to talk to you. I suppose maybe to start with, you're slightly ahead of us in the UK. You've started to open things up again, kind of the bars, the restaurants and stuff like that. Do you feel, is there a bit more positivity around the place? You know, are people a little bit more upbeat with the kind of the reducing of the lockdown, the restrictions?
Definitely, they definitely are. And I think that what I've noticed is people are just so much more appreciative of being able to do something like sit inside a pub or a restaurant. It's amazing. We didn't appreciate it before. We needed to not have it for a year and a half.
I know, it's amazing. Even just going out now, and the thought of sitting out and having a meal is lovely. We're kind of, I think it's the 7th of June, we're looking at the outdoor dining is opening, and then they're kind of looking at July. So we're a little bit behind you, but we're all pretty excited for the summer. Christine, maybe we can start for people that I suppose wouldn't know anything about DBT. Could we just kind of, and for people that are listening, DBT is Dialectical Behaviour Therapy, can we give a little bit, maybe your synopsis of DBT and what it is, just for people's understanding, if that's okay?
Sure, yeah. So DBT is a therapy that is derived from cognitive behavioural therapy, which was developed by Marsha Linehan, professor at the University of Washington in Seattle, and it was devised to treat suicidal women. That was the first cohort of people that she wanted to treat. And she was told at the time that if you want to get funding, then you should treat a disorder. And this is going back into the 80s. And she did a battery of tests on those women and found the most commonly occurring disorder was borderline personality disorder. And so that's what she ended up treating. And it differs from cognitive behavioral therapy by the addition of a lot more stuff. So in addition to one-to-one therapy, people have a skills training group. It's a team treatment. So instead of getting one therapist, you get 4 therapists or more. Some do your skills training, some do your individual therapy. So a community of clients are treated by a community of therapists. And you should get telephone contact as well with out of hours with your individual therapist, or perhaps sometimes on a rota of people. And your therapists will go to a consultation meeting. So they discuss any issues that there are with your case. So you get the benefits of more minds on your case. So that's the nature of the treatment. And dialectics, if I had to give you a pithy definition of what dialectical means, it means it depends. That there's no one size fits all. You have to sometimes do more of something, sometimes do less. You have to tailor what you do to fit the circumstances. And the last thing I'll say about it is it's a mindfulness-based therapy. It's behavioural with a big B, and we work in the present moment. So we don't drag up all your past. We work very much in the present. There you go.
Yeah, fantastic. Yeah, and I suppose DBT now as well. It's used by many practitioners. I suppose the skills of DBT to treat many different disorders. Like I suppose originally for borderline personality disorder, or more commonly in Europe, kind of emotionally unregulated personality disorder. But for people presenting with things like depression and anxiety, or struggling with anger issues, that therapists are really seeing that DBT skills are a fantastic way to kind of help and support their clients. Are you seeing that it's kind of becoming more and more of a common therapy outside of that sort of origin of what DBT was originally used for?
Certainly. So we've now got an evidence base that covers multiple behaviours. So rather than thinking of diagnoses, we'd rather think of any behaviour that you want to change. So it could be behaviours that maintain depression, or behaviours that maintain anxiety. It could be an eating disorder, drug and alcohol problems. It's been used for offending behaviours in prisons. So there's been a massive expansion in the use of DBT. So any behaviour that you want to change, really.
Yeah, it's super effective. What I suppose I trained. You were one of my first trainers in DBT, actually, back in 2015, and I suppose my original training was behavioral therapy, but one of the things that kind of, I suppose, pulled the rug from under me at the time was mindfulness, and it wasn't something that I had done much work in. And I suppose my understanding of mindfulness was a little bit misguided as well, should I say. But it's just so important. And can you maybe explain the important role that mindfulness plays for all of us, really, but especially in that kind of trying to regulate emotions, or keeping our emotions regulated so we're not getting into a distressed state? Can you just kind of expand on that for me a little bit?
Yeah, well, I guess your mind is not your friend. Your mind goes off on its own track. And mindfulness is the art of noticing where it's gone, and noticing when your mind has done something uninvited by you. So not something you intended it to do, not something you wanted it to do, not something that has any benefit to you, like going off worrying about things that are going to happen, dwelling on things that have happened, creating an alternative universe in which you live, telling you all nasty things about yourself. Your mind can do all of these things. It's not your friend. And so mindfulness, noticing the skill of noticing where your mind has gone, and then being able to guide it back to whatever is effective for you. That's the main thing. So that's why it's core to the therapy.
Yeah, and I suppose the core components of DBT, kind of, you have your mindfulness, you have your distress tolerance skills, your emotional regulation skills, and your interpersonal effectiveness skills. If we can kind of look at kind of emotional regulation, and maybe just again, you can expand on this a little bit. That, I mean, sometimes we think about emotional regulation as kind of downgrading the emotion, but it's not always that. And
thank you for saying that. Just thank you for saying that. Because that is the reason that I wrote the book. That is the reason that I wrote the book, because so often I was hearing people say, oh, you need to do emotion regulation. And what people were generally doing with their clients was just distracting them. And, okay, if you distract someone from an emotionally evocative situation, then the emotion will go down for sure. It goes down very quickly, within about 3 seconds rather. And then when you represent the same situation, the emotion is just going to come back up again. So that is not emotion regulation. Emotion regulation is teaching people to live authentically with their emotions, learning to value every single emotion, because it's telling you something. it hasn't come from nowhere. It's come from somewhere. It's telling you something. But it might be slightly off for the circumstances. That's all. It might not fully match the facts. So you could be angry about what somebody did, but you're furious instead of a bit cross, or, you know, you're devastatingly sad, but maybe you didn't need to be that sad. And sometimes you're not sad at all, and actually you need to be more sad. So real emotion regulation is looking at the facts of the situation and saying, how much emotion do I want to have? How much emotion do I want to have here? How angry do I want to be about this thing? And it might be different one day than another day.
Yeah. So, and if the book, your new book is Regulating Emotion the DBT Way, and this is kind of a practical guide to DBT skill of opposite action. And I think lots of people use opposite action. I mean, you know, in a very simplistic way, you know, you might want to go to work some morning, and, you know, you get out of bed and you go to work, and, you know, you're practicing opposite action. You know, if you don't go to work, something could happen. But I suppose where a lot of people that maybe are struggling with emotional regulation, and, you know, are in a distressed state for one reason or another, they might struggle to implement that when needed. Can you maybe talk a little bit about kind of opposite action, the kind of theory behind it, and its important role, I suppose, in us regulating our emotions and us becoming more behaviorally effective?
Right, yes. And I think you made a really good point there, that we all use emotion regulation skills. We all have to get ourselves to do some things, and sometimes we have to temper the emotion that we feel, but we don't necessarily just get rid of it. So if you're angry about something, an example I use in the book, you know, if you are angry because your pay is wrong, and you've rung payroll and they keep getting it wrong, then you find out one morning, you go in and your pay slip's there and it's wrong again, and you've been over this with them a number of times. You're really angry, but a client is waiting at the door, so you can't just give vent to that. So you temper it, and you see your client and you act opposite to the emotion in that moment. And then later on, when you ring payroll, you up it a little bit, because that is motivating you. Being angry about it is motivating you to solve the problem. And you want to put a little bit of firmness in your voice, and you want to say, no, I have spoken to people and I want this sorting out. So you up or down regulate the emotion according to the circumstances. So it's teaching people that the way that you do that, so you might do that automatically. But we know in DBT that there are a set of signature features for every emotion. And if you act opposite to the specific features of that emotion, the facial expression, the voice tone, the body posture, the signature things that tell your brain that that is the emotion, if you act opposite to each one of those in those domains, then the emotion will come down. The most important thing is, though, don't get it down to zero. We don't want to get it down to zero. We want to get it down to the level that matches the facts. And that's your call, really. It's up to you. We're not telling people how to feel. We're saying we'll teach you how to drive the car of your emotions, how to get it to go faster or slower. And then you are in control rather than your emotion being in control of you.
Yeah, a simple way I put it, and it's simple, is often that sometimes the emotion fits the facts, and sometimes it might not at all, because our interpretations or thoughts or assumptions are, you know, misinterpreted, misguided. And sometimes the emotion might fit the facts, but the intensity is just far too high. And like, I suppose if we take maybe an emotion like anger, and you've named it, like, could you give that sort of example for that, of, like, you know, specifically how that might occur, just with anger, for instance? Like,
yeah, sure. So if I was angry and I was livid, then my brow would be furrowed. If I want to down regulate the emotion, I'd smooth out my forehead. My temperature would be hot. If I wanted to down-regulate, I am going to cool myself down. My breathing will be, I'm so angry about this, you know, and I would take longer, slower breaths, like blowing up a balloon. I breathe out like blowing up a balloon. My muscle tone would be tense, and so I would act opposite to that. My voice tone, that would be really important. If you just try saying now, Rob, say, I'm not very happy about that.
I'm not very happy about that. Do you want me to say it angry?
A bit more angry than that. Come on.
Of course I can. I'm not very angry about that.
I'm not very happy about that.
I'm not very happy about that.
Right. And now say it in a kindly voice.
I'm not very happy about that.
Yeah. So when you speak in a more kindly voice, the intensity of the anger goes down. You can't maintain it. In fact, if you just lie flat, the intensity of your anger will come down, because it's not a posture your brain associates with being angry. So there's all these methods that are just teachable. We can actually teach you how to get more sadness, how to get less sadness, how to feel more intense joy, how to feel less intense joy. There are times when we're joyful about things that don't do us much benefit. And, you know, we like seeing your drug dealer, for example. So, you know, we might want to down-regulate that. So these are teachable skills, and it is really effective. I can't tell you how effective it is. It's a great skill to have. I'm so enthusiastic about it.
Yeah, no, it's amazing. I mean, even again, like things with like sadness, you know, and you know, the action urge from some sadness might be to kind of isolate or to hide away. And someone, you know, it might be rational for them to be sad, but it mightn't always be helpful for them or effective for them to be acting out in that sadness. So, you know, even identifying that and identifying what their opposite actions might be when they're experiencing that. It's so valuable for clients, and it's not often something that they consciously have thought of, like, you know.
It's that part of it. It's bringing it into your conscious mind, so that you know. And I think this, and I don't know what you think, Robert, if you agree with me, that many clients, when it comes to sadness, they need to just be able to be appropriately sad.
Yeah.
Fight that, and they block that out. So from a therapist's point of view, sometimes the first thing I do is tell people the actions that they can do opposite to sadness to bring it down if it's too intense, in order then that they can learn how to be appropriately sad, because they don't have to be terrified of it anymore if they know, when I've done enough sadness, I can end it. I mean, you cannot stop being sad forever about something. Sadness is one of those emotions that nature allows us to delay, and it causes us a big problem. And the reason nature allows us to delay it is because if you were in a battle, for example, if you think of soldiers on the front line in the war, and they were with their comrades, their friends, and their friend was killed beside them, then nature says you can delay the sadness in order to save your life, right? Get to a place of safety first, and then grieve the loss. And so we have this capacity to delay sadness. But then when we let it in, because we've got a backlog, it feels huge. So we have to learn how to do one sadness in the moment. What am I sad about in this moment? And we have to learn how to allow ourselves to cry willing tears, and how to stop them if we feel they're going on too long. And that's a judgment call. You know, you can't push it away forever, and you can't let yourself be in floods of tears forever either.
Yeah.
So that's the skill you need, up or down.
Yeah, it's amazing. And, you know, like with sadness as well, and just what you were saying there, it's a little bit about kind of sometimes people are invalidating their own emotions. And, you know, can you talk a little bit about that just sort of self-invalidation that people can do? you were kind of talking about it there actually, but just so people can kind of understand that, it's a really important thing for people to understand that sort of point. Sometimes it's not just other people are invalidating, sometimes they're invalidating themselves.
They do. And that's why the mindfulness is key, because that little voice in your mind going, oh, why are you sad about this? You've got no right. Other people have much worse things. Oh, well, you've got no right to be angry about this. You've got to see it from the other person's point of view. That's what it's about. And we frequently engage in ways of denying our emotions. And on the other side, sometimes they just hijack us and they're too big and they're too strong for the situation. So I always want us to remember that dialectic. It's not one or the other, it's both and. Both things are true.
Yeah, and it's sometimes as well, you talk about emotional hijacking, there's people just get caught out in the moment, and something, obviously, if someone's angry for some reason or another, they've had a long day and they come in home and I don't know, their partner has asked something of them, they overreact to that. It's like, they've already been struggling, they've been having a difficult day, but now they make that day worse by how they react to that situation. And, it was possibly inappropriate in that moment. And, is mindfulness something there that actually could prevent that as well, in happening in the first place? And, obviously someone can practice opposite action, but when they get caught or emotionally hijacked like that, it's very, very challenging. I often talk to people about firefighting a little bit, that, people's go-to skills sometimes are just distress tolerance skills all of the time. But, we really need to learn to process our emotions and to help and support ourselves from becoming dysregulated. And, you're a huge advocate for mindfulness. Is that why that core component is there, and it's kind of in DBT specifically,
Yes, and we know that the impulsivity that comes from having emotions that are strong and sudden, that can be helped by the practice of mindfulness. And mindfulness is a discipline. It's not relaxation. And I think sometimes people mistake it for relaxation. And they say, oh, I did that mindfulness thing and I'm not relaxed. It's not about that. It's about being able to have the experience of the moment and then let it go. Have it, let it go. Have one moment, let it go, have the next moment, and not carry forward things into one moment after another moment after another moment. So the guy coming home from work or the woman coming home from work can hopefully leave behind what happened at work when they step outside the door, because this is a new, fresh moment. However, I don't want to misrepresent the skilled, the skill of mindfulness, because it's like any other skill. You couldn't get in a car and just drive it. You couldn't sit at the piano and just play a complicated piece of music. You have to practice. And if you practice daily, then over time, you are able to notice when you are stacking up these things. You are able to calm yourself down because you can get into the moment. It's a practice thing. An example I used to use is when my kids were young, we used to play badminton. The family would play badminton. I was always the weakest player at badminton. I would stand on the court with holding my racket, and I would hear this noise, and I would say, "What was that?" And they would go, "That's a shuttle going past your ear." And then I'd go, "No, I wasn't ready. Like, let's go again." "What was that?" "No, you missed it." And I would think, how can anyone get this tiny racket head in front of something that's going that fast? But over time, you practice, and then you can start to return the shots.
You're paying attention, and like anything, like you said, practice makes perfect. And I suppose often people are hoping to get, I suppose, more rewards a bit too quickly when they're practicing any skills, and it is about being consistent, and it takes a little bit of time. And I would be, someone, I practice quite a lot of mindfulness, and I think what you find, from practicing the formal practices is that, over time, and these are just formal practices that you might be implementing on a more daily basis, but it starts to kind of just come into your day-to-day life, so you are far more aware of when your mind runs away with itself, and you're able to sort of bring it back, and so you're far more cognizant of all of that. And I think that can actually start happening quite quickly for people if, like you said, people take a little bit of time and try to practice it daily. And it's just it's in DBT we talk a lot about mastering skills, and it's that regular practice of something is so important.
It is, and at the same time, I love that part of DBT that says a lot of these things are not character flaws in you, they're just it's not a character flaw, it's something you can learn. It's so destigmatizing. So I hope that we can get that message across to people. These are skills other people might have learned them in childhood, they might have learned them through a different route, but you can learn them too.
Yeah. Can you maybe talk just to feed into that a little bit, just in relation to kind of maybe how trauma, I suppose, and negative life events can impact people's emotional regulation, and their ability to emotionally regulate. Can you explain that a little bit for people, how trauma does affect that?
Right. So, I mean, we do know that in any case, there are brain changes when you have suffered severe trauma, and they affect your memory, they affect your reactive system. So we know that you have disadvantages in that way if you've had a trauma history. But the element that DBT focuses on is that abuse, neglect, constant criticism, can have an effect by invalidating your emotions. So whatever you think or feel, somebody tells you that's wrong, eventually you stop attending to it. If you've been abused, and many people have been abused in childhood, and they have said, please don't do this, they don't want it, and they've just been ignored, their pain has been ignored. Eventually they have a different relationship with their emotions. They think, what is the point of having any emotion? And their main focus then is getting rid of the emotion. So that's why over time it builds up. They try various things to try and get away from that emotion. It might be prescription drugs. It might be drugs that you can get over the counter. It might be oversleeping. It might be just avoiding things that would cause emotion, staying in your house and binge watching Netflix. It might be drinking, drug taking, street drugs, and harming yourself, thinking about being dead. All of those things are ways to not feel. And what we want to do is put back the joy of emotional experiencing, and let people know their emotions are important and their emotions are their friend, and they can have some control over the intensity of that experience. Marsha said it's like, Marsha Linehan said, it's like having a layer of skin missing, like a burns patient, so that every move is painful. And we can reverse that. It takes time, but we can reverse it.
Yeah, I think it's very important for clients to know that as well, that like, there is hope there, and, there are people out there to help them and support them. And just what you were saying there a minute ago, people that have had those very negative life experiences, sometimes they start to believe these things to be true, and, they are saying these things about themselves. And, whether someone comes in with very extreme fear, or, they're coming in the door with, very, very low self-esteem or poor self-worth, there's always a reason. And I think Marsha put it well as well. If I'm quoting her right now, you can correct me if I'm wrong. I think she put it along the lines that, everything is as it should be because of everything that has gone before it. There was something in relation to that. And that makes a lot of sense. You know what I mean? There is a reason that, we are like this, or that this person is struggling like this because of certain events or life events that have taken place that have led up to this. And that
it's not fixed. That
yeah,
transactional process of one thing leads to another, leads to another, leads to another. It carries on. It carries on today, tomorrow, the next day, the next day.
yeah.
So you always get another turn, to make a change in it. Everything you do is another chance to make the direction go back the way you want it. It's such a positive therapy. It's such a hopeful therapy.
Yeah, it is. Yeah. And I think the best thing about these kind of skills-based therapies for me is that, you can talk all day long about stuff, but without having skills to kind of regulate or to bring down your distress, or, it can be really, really challenging to kind of, you're constantly firefighting, I suppose, and that's what I do love about DBT, and why I find it, it's helpful for so many different presentations, but like I've said, and it's really, really wonderful. Another thing that I find very interesting is, secondary emotions. And often people, they've never thought about that. They never really understand, okay, Jesus, this is a secondary emotion. And, this is why I'm experiencing this. And sometimes people are in a secondary emotion and they don't understand that there was a primary that led to that. Can you expand on that for people a little bit? Just the difference between a primary emotion and a secondary emotion, and how it kind of occurs.
Yes, so a primary emotion occurs in response to some trigger or cue, and a secondary emotion occurs in response to the primary emotion. So if you get sad about something and you really find sadness incredibly painful, but you shift into being angry about it instead of being sad about it, then that anger can feel more powerful and more tolerable. So that's a common pairing of, primary and secondary emotion. So what might happen is, as you act opposite to the anger, if it's a secondary emotion, then as you bring the anger down, the sadness can bubble up. So we just let people know that could happen. And people often say to me, "Oh, I'm just angry all the time," or I feel ashamed all the time. And that's not strictly the way emotions happen. They kind of wax and wane all the time. They get big and small all the time. So, even in a real crisis situation, you'll have peaks of intensity of the emotion, and then it will go down again, and then it will go up again, and then it will go down again. So it's important that people know they're not experiencing all these emotions all together. And that's why in DBT, we do these chain analyses so that people become more aware of what their emotion is at any given time. And then we can usually track, oh, I see, you got sad and then you got angry. And that helps us identify primary and secondary emotions. And at the same time, I say to people, do you know what? Don't worry about it. Regulate the emotion you're in, and then see if another emotion pops up. If it does, then that emotion was a secondary emotion.
Yeah.
Don't worry about it too much.
I think people do find it very interesting, though, and I think it is very enlightening for them when they do find that, you kind of explain that process, that, anger isn't always your primary emotion. Anger is often your secondary emotion. Something took place or something happened that either upset you or made you sad. And as opposed to, and sadness is a difficult emotion for people to sit with and, to hold. And it's much easier to jump into anger because it can be offloaded a lot quicker for people. That it's actually quite enlightening for them to see that, because it's really helpful. And, oh yeah, I'm sad, actually this makes me upset. And it's like a penny sort of can drop with people, and you're kind of saying, okay, this is really cool. And that's what I love about DBT as well. There's so many different aspects to it that people find really helpful, and the clients find very, very helpful. And it's very adaptable to people's lives. It's very easy to kind of digest, I suppose.
It is, yeah. And that question, does my emotion match the facts? If you ask yourself that and really you're sad, then your anger probably doesn't match the facts. You're probably wondering why you're angry, because you're not being blocked in pursuit of a goal or threatened with something. So the process of the skill will help. It will really help.
Yeah, it's fantastic. Christine, your new book looks. I have it pre-ordered, by the way, so it's on the way. So it looks amazing. There's so much in it, you know. So the theory of emotional regulation and dialectics, emotion functions and forms, the theory of opposite action, emotional validation, problem solving, and then you, in kind of part B of the book, you go through all of the different emotions and individually break them down and how to regulate them.
It's a book for therapists, really.
Yeah.
And at the same time, I've had loads of people who are family members of people who, you know, have these problems, or people themselves who've been in touch with me and said it's really helped them. So I think, you know, even though it's written for therapists, it's a very user-friendly book.
100%. Yeah. It's definitely, I think obviously it's a great guide for therapists, but I do think it's a very digestible book as well for people that might struggle with their emotions and emotional dysregulation of some shape or form. And especially when you're breaking down all those emotions individually. It also very well done. Top 100 in Amazon's bestsellers, which is fantastic. Really good in its new releases. What I would say is I really encourage people to get out and buy it. Definitely a fantastic book for therapists, and also check out Christine. Christine is over 30 publications, but if people are really interested in mindfulness, check out this book. It's teaching clients to use mindfulness skills. It's a fantastic book. Herself and Maggie Staunton wrote that book. Christine, thank you so much for coming on. I really appreciate you taking the time. It was lovely speaking to you. And
thank you for asking me. I'm always happy to talk about DBT because I absolutely love it. I think people know that I really love it.
Yeah, you're one of the DBT queens, definitely. Yeah, fantastic. Christine,
I'll take that.
That's really good. It's really positive. We'll definitely do it again sometime, please God, in the future. And thank you so much for coming on. I really appreciate it. And come here, have a lovely evening.
Thank you very much.